good morning, good afternoon, good day. What's good? Hope everybody is doing fine, living healthy, taking care of their edges. Guys, today I bring to you some information as a pharmacist. Oh, sorry, pardon my mistake. My name is pharmacist Ebube Okoye, and I just thought to give some information on something very important. Do you have a first aid box that contains cotton wool, plaster, GV, and the rest for treating cuts and bruises and injuries that you sustain at home before you head over to the hospital? Now, as you have a first aid box for treating injuries and cuts, do you know that your body internally, your system also needs a first aid box? Now, what do you do when you wake up in the middle of the night and you're having a stomach upset? You use the toilet like 10 times before day breaks, and at the end you're not able to have enough sleep that night. Now you get a clue on what I'm talking about. So today I bring to you the first aid medicinal treatment that you need to definitely have in your house. Like I already mentioned, one of the drugs you need is your anti-motilants, and the common drug there is loperamide. This is the first line treatment for stomach upsets. Now you wake up in the middle of the night and probably what you ate the previous night is giving you a stomach upset and you have to use the toilet a lot. You don't need to go through all that hassle. What you need to do is to make sure you have loperamide in the brands of Lodium, Imodium, and etc. There are a lot of brands in the pharmacy. Just make sure you have at least a pack at home. So when you wake up in the middle of the night and you are having that stomach upset, just take 2 capsules out of it and swallow with water. Then if at all you have the need to go to the toilet again, after that make sure you take in 1 more capsule immediately after. Trust me, you won't need to use the toilet 10 times before day breaks. So that is a must have at home, because we really eat a lot of things that do upset our stomach. Also, if you have kids at home like small children, babies, you definitely need to have ORS and zinc. That is their first line treatment for runny stomach. Kids of course do normally have runny stomach because they put their hand a lot in their mouths, and that introduces a lot of germ into their system, so it tends to upset their stomach. Now you need to have your ORS and your zinc. Now if you want to give that to your child, you have to dilute it in 1 liter of water. So dilute 1 full sachet of ORS inside that 1 liter of water and put in 1 tablet of 20 milligrams of zinc into that. Dilute it, make sure you shake it very well. Then, not to be consumed all at once, just 1 sachet per day. Please do not take antibiotics anyhow. For those that will always run to flagyl when they have stomach upset, please and please, flagyl is not the first line of treatment when you have a stomach upset. The only time you are supposed to take flagyl and the rest, or tinidazole or ciprofloxacin, is when you have bacillary diarrhea and dysentery. In that case, you might experience a foamy stool or blood in your stool. That is the only time that flagyl will suffice. If not, please stick to your loperamide if your stool is just watery. And very importantly, please, if you're taking any of these prescribed drugs like antibiotics, anti-malarial, please make sure that you finish up the duration. For example, if it's for 3 days, stick to that 3 days and finish it for that 3 days. If it's for 7 days, 5 days, make sure you consume it for that duration. Do not for any reason stop taking your antibiotics or prescribed drugs, maybe because you feel better, you feel relieved. Do not do that. Another medication that you definitely need to have at home is your analgesics. The likes of paracetamol, ibuprofen, diclofenac, these are called painkillers. You wake up in the middle of the night and you're having this banging headache for whatever reason. What do? You pop your paracetamol, or you're done with work at the end of the day and you probably did not listen to your body well enough till you're back home, maybe at night. Now you're faced with a lot of body pain that won't even let you sleep at night. What do? You take your NSAID, that is non-steroidal anti-inflammatory drug, which is either ibuprofen or diclofenac or the rest. But mind you, analgesics are not to be taken too much and too often. Just make sure that you have the right dose of these medications. For diclofenac, 100 milligrams a day is enough. ibuprofen. 400 milligram a day is enough for adults. Now for kids, of course, when you buy the ibuprofen suspension, the doses for each age bracket is there. So you also need your analgesics for fever. Probably you're down with malaria in the middle of the night and you have fever. It normally comes with that. So to manage the distress before day breaks, for you to get your anti-malaria, you just take the analgesics. That will help to reduce the fever. Also for kids, it works perfectly well. Painkillers are not medications that you're meant to depend on. They are not to be taken for over 2-3 days. They are not to be taken too often. If you are an ulcer patient, kindly note that you are not meant to use NSAIDs. Rather, use celecoxib. These drugs are safer for you because NSAIDs worsen ulcer and NSAIDs can cause ulcer. Chronic use of painkillers, including paracetamol, can actually damage the kidney and the liver. So be careful. There are analgesic creams that you can get to massage your muscles, your joints, that part of the body that really aches, just in case you don't want to pop medications. You can definitely use the cream to massage your body. Another medication that you definitely need to have at home is your probiotics. Guys, probiotics are really underrated. Now let me give you a little idea of what probiotics do for you. In your body system, for example your stomach and your genitals, there are normal microbial flora that exist around there, but in moderate and reasonable quantity. But one of the things that make us fall sick is when there is an outgrowth of bad bacteria and bad flora in your body. There is an overgrowth. When the bad microbial flora outgrows the good microbial flora, they cause sickness. For example, in the genital, you can start having urinary tract infection. So one of the things that probiotics do is that they help to boost the volume of the good microbial flora. So those good microbial flora will help to fight the bad microbial flora. That's what probiotics do. So for example, in your stomach, your digestive system, imagine when the bad microbial flora outgrows the good microbial flora. You might start having a lot of illnesses like stomach upset, diarrhea, dysentery, And good health starts from the digestive system. It starts from having good balance of microbial flora. So also probiotics help to aid digestion and in general good function of the body. So you definitely need to have some probiotics. You can get some of them in sachet form and in tablet form. You can take them daily or as often as you want. Another set of drugs that very importantly you need to have at home are your antacids. Now these drugs take care of hyperacidity, heartburn and bloating and the rest. For example, the Gestid, Danacids, Mistmag, Polygel, they come in tablet and suspension form. Just imagine you wake up in the middle of the night and you're having some indigestion, probably you ate late the previous night, which I do not advise. Some of the symptoms of indigestion are, of course, weakness, dizziness, because the food that you consume that is supposed to supply energy to the whole body has not yet been digested. And of course, you have discomfort in your stomach, you're going to be bloated, and possibly you belch a lot with an acidic taste in your mouth. You will have this nauseous feeling, the feeling that you want to throw up. And that can as well come with stooling, so you might be doing both at the same time. So some of the things that actually cause indigestion, aside from eating less, is consuming a lot of oil. I personally have experienced that like 2 times. I consumed beans porridge prepared with a lot of oil and I had a lot of other symptoms that I mentioned earlier. And of course, not freeing up your zipper or your belt before eating. You're having some indigestion, you're bloated, or you're having heartburn. Basically, you're hyperacidic. These are symptoms that antacids do take care of. Another category of drugs that are definitely a lifesaver are the anti-inflammatory creams. These creams are used to prevent and to treat inflammatory reactions due to bacterial infection or fungal infection or allergic reactions that cause bump on the skin. They can also be used to prevent post-shave bumps. These creams are only used for external purposes on the skin. Another class of drug that we need to look into are the fiber supplements. These supplements are really very good for prevention and treatment of constipation. Just imagine you're a lover of white bread. White bread causes constipation a lot, excess consumption of that. Also, if you're not fond of drinking a lot of water or consuming your fruits and vegetables, you are definitely liable to have constipation. There are also a lot of reasons why you would be constipating at a time, and definitely you need to have your fiber supplements. For example, Ispaguilla husk, psyllium. These are very good fiber supplements. They come either in tablets or powder form or grain form. You should definitely have them at home. Also know that constipation is one of the side effects of some medications that are used to treat certain chronic ailments like blood pressure. So whatever the cause may be, if you have that inability to pass stool, please know that you are not to strain that stool, because you will either develop hemorrhoid or you have a tear in your anus. So just go ahead and take the relief measures that I mentioned earlier, and hopefully within minutes you'll be able to pass your stool effortlessly. But if you are experiencing a chronic constipation and a very serious one, then by the next day you should find your way to the pharmacy or to the hospital. The last category that we are going to be looking into today are the anti-allergic medications. These medications are used to treat allergic reactions. For example, loratadine, chlorpheniramine, levocetirizine, cetirizine, and the rest. These tablets are used to treat allergy and allergic reactions in the respiratory system, on the skin, and whatever you may be reacting to. For children, you definitely get them in the syrup form. These medications are very, very good. Definitely very important to have at home in case you are down with catarrh, flu, allergy, especially during cold season. You need to have them at home. Thank you so much guys for watching. We've come to the end of this video. If you really loved it, smash the like button, drop a comment in the comment section, and of course hit the subscribe button as well so that you don't miss out on any of my videos. See you in my next video. Bye.